Hello, my name is student Dr. Alyse Bryant. I'm a second year dental student, and today I would like to discuss with you all the importance of oral health.
Will you pick up the phone when Dr. London is calling?
Hello, welcome back to my channel. If you haven't already, please like, comment, subscribe, just to make sure that you're keeping up to date with the videos. Videos drop every other week. With not further ado, I called up a friend to talk about the importance of dental health. Because sometimes, we tend to neglect that, especially, in the minority community. We're like, why do we need to get our teeth checked? I'm brushing my teeth. I keep it clean, but it's important to have those checkups every 6 months because it could be some things that we are missing. And that one thing we're missing can save your life. So I called up student Dr. Alyse Bryant, and she is going to just talk about the importance of dental health.
Hello, my name is student Dr. Alyse Bryant. I'm a second year dental student, and today I would like to discuss with you all the importance of oral health. First, I want to associate oral health with overall health. So if we're aware and cautious of what we eat in moderation, of course, this is great for our overall health and our oral health. So for example, if we take in the right amounts of protein, vegetables, and fruits, that helps decrease the chances of dental caries disease, also known as cavities. But if we take in a lot of carbohydrates, such as candy, sugary foods, and sugary drinks like juices, sodas, and energy drinks, that increases your chances of dental caries disease. Another association I would like to make with oral health and oral overall health is the fact that the mouth or the oral cavity is a prime way for bacteria to enter and travel through the rest of the body. That's why it's so important to brush and floss to keep your mouth as clean as possible. Now, there are 4 factors I want to point out that are important in the dental health world and why they are important. Those 4 factors are host, time, fermentable carbohydrates, and carcinogenic biofilms. So carcinogenic biofilms are bacteria in the mouth. Fermentable carbohydrates are those sugary foods and drinks. Then the structure, the host, the tooth structure is the host. Those two interact on the tooth structure, and over time you get a cavity. But I would like to point something out. These are not the only factors that can cause a cavity. There are other factors, but not limited to such things as saliva, your environment, your lifestyle, your immune system, and even education. Now, when you visit the dentist, there's a way they'll determine, first of all, even if you have a cavity or not. But then they'll determine if you have a cavity, what type of cavity it is based off the extent of the cavity. So that could be called an incipient caries or a cavitated caries. So incipient caries is at the enamel of the tooth structure, which is the first layer of tooth structure. It has not gone into the dentin, which is the second layer of tooth structure. Therefore, it's a possibility that it could be reversible. And one of the treatments for that is fluoridated treatment. Now, a cavitated carie is not reversible. The dentist will have to do an operative intervention and perform a cavity preparation. And this could be a class 1 cavity preparation, class 2, 3, 4, 5, or class 6 cavity preparation. And then from there, they'll proceed with the filling. So those cavity preparations, classes 1 through 6, are just determined by the location of the cavity on the tooth. Now, I would like to also point out that when you make those regular visits to the dentist, they will perform an intraoral examination. And they can determine if you may have a disease based off certain clinical signs in the mouth. So an example would be for diabetes, if you have gum sensitivity or periodontal disease, which is the infection and destruction of the gums and the bone that surrounds and supports the tooth. If that's destructed, you can lose teeth because there's nothing supporting the tooth anymore if that bone is gone. These are some clinical signs for diabetes. Not for sure, but these are some strong signs. And the doctor can refer you to the physician so you can get further testing. So also, HIV has some clinical signs that can be seen when an intraoral examination is given. One of the signs is oral hairy leukoplakia, which are white lesions in the mouth. Another example is oral candidiasis or oral thrush, which can be wiped off. It's like a white coat on your mouth, in your mouth, and it can be wiped off with a gauze off of the tongue and treated with the antifungal. So these are just some signs. It's not to say that the person would actually have HIV, but these are some clinical signs. And again, the dentist can refer and you can get further testing. Now, I would like to point out that these are just some examples. The dentist can also see clinical signs for oral cancers, for osteoporosis. They can even see clinical signs of stress. So that's something to think about when you visit the dentist, that they have the unique opportunity to see some of these clinical signs, and sometimes even before the physician, before you make that appointment and visit to your physician. Now, I would like to remind you of some things. Please brush your teeth twice a day, at least twice a day, for 2 minutes each time you brush your teeth. Use fluoridated toothpaste, floss daily, use mouth rinse, and don't forget to make those regular visits to the dentist, which is typically twice a year or once every 6 months. Sometimes there may be special instructions for you to visit the dentist more frequently each year, but if those are given to you, please follow those instructions. Also, as a reminder, please change out your toothbrush head if it's an electric toothbrush, or if it's a manual toothbrush, get a new toothbrush about every 3 months. Or if you were sick, say you had the cold or the flu, change your toothbrush out. Lastly, I cannot forget about the kiddos. When you see that first tooth eruption, that child should have a dental home within 6 months of that first tooth eruption, or by their first birthday. Thank you for your time.